if someone has had COVID-19 and recovered, do they still need to get vaccinated? And my second question is, can someone get vaccinated if they are currently sick with COVID-19?
Excellent questions, Lucille. Thank you and good morning. So the data on the first question, people who have had COVID and have recovered, should they get vaccinated? The answer to that is yes. We are still not entirely clear the immune response that people develop to COVID infection as compared to vaccination. It appears that people who have been infected and get a subsequent vaccination have greater antibody immunity, so greater volume of antibody that we can detect. We still don't actually know if that's the right measure for immune protection, meaning there are two parts of our immune system responsible for keeping us healthy against infections. One are antibodies made by our B cells, and that's the thing that we can really quickly test in our blood. It's super easy to do, technologically speaking. The other arm of our immune system that helps protect us against infection are the T cells, T as in Tom. So T as in Tom, B as in boy. T as in Tom cells are way harder to test for, are they educated and trained to recognize this infectious agent, and can they do their job to help keep bodies safe? We know the T cells are really important in preventing people from getting sick from infections in general, but measuring how smart, how well they've been educated, either by an infection or a vaccine, is much harder than measuring antibodies. And so we can't yet determine if by being infected, our T cells have gotten as educated as our B cells. Similarly, we can't yet tell if the vaccine is educating our T cells as effectively as it's educating our B cells. And so the clear answer is, if you've been infected, there is no reason not to be vaccinated. There may be evidence that one is sufficient if you're getting a 2-dose type vaccine, meaning Moderna or Pfizer. But even still, right now, the current recommendation stands that get both if you're in line to get Pfizer or Moderna. Obviously, J&J is a single dose. As far as your second question, if you're currently infected with COVID, should you get a vaccine while you're actively infected? I don't know that anyone has done a scientific study for me to give you a data-based answer, but I can say that current health practices are no, wait till you're recovered. That's true for any vaccine, because you want your immune system not to be challenged when it's already being challenged. Because what a vaccine does is tries to wake the immune system up and say, hey, danger, learn this, remember this, go after this if you see it again. And if your immune system is already in a battle to try and get rid of something, it doesn't have time to pay attention to, hey, learn this, pay attention. So the best practice still is let people recover, let your immune system recover, and then get vaccinated.
One last question for me. When you say someone is immunosuppressive, what disease are those?
Right. So really what we're thinking about are treatments as compared to diseases. Mm-hmm. So there are certain autoimmune diseases in particular, as well as certain blood cancers in particular, where we use a drug that targets B cells, that tries to wipe out B cells because of the nature of that disease. Because autoimmune diseases mean, in general, we're making B cells make antibodies that then attack our bodies. So we're trying to quiet those B cells down. And so the drug that's used in that case, or similarly in a blood cancer where our B cells have gone a little crazy, like lymphoma, we use a drug called Rituxan or rituximab that literally takes out the B cells. And it takes them out for months. It takes them out for like 3 months, depending on how many doses and the nature of the illness you're being treated with. So if you've had the drug Rituxan, you probably don't have B cells ready to be educated. Now, as I said, it doesn't mean you don't have T cells, but T cells and B cells talk. So if your B cells aren't around because you've just received Rituxan, it's unlikely that the vaccine is going to get a good foothold because your B cells have been compromised. So it really is about Rituxan and the availability of B cells to be educated as compared to, oh, I have an autoimmune disease, like I have hypothyroidism, for example, which is an autoimmune disease, but I'm not taking Rituxan for them. I'm taking a supplement to replace my thyroid. That doesn't mean I shouldn't get vaccinated. So really, I would talk, if anyone has concerns about their eligibility for the vaccine because of a current existing health condition, talk with your doctor. And like I said, more than anything, really what we're seeing is if you are actively receiving Rituxan or recently had Rituxan, the other thing would be if you're on high dose steroids. And again, your doctor would be able to guide you if you're on very high dose steroids, because again, steroids dampen the immune system's ability to respond. That's the point of them. But high dose is, you would know, I would think, if you're on that, as compared to sometimes someone has like an exacerbation of lung disease like COPD, and you get a pulse steroid, that would not preclude you. For example, those would not be considered a high dose steroid.